Crystal, it's just so nice to have you here. And when we first time connected, it was what, probably about a year and a half ago.
Yes.
I always had a really good feeling that together we'll be doing some nice things. And with all the work that you did on promoting scientific evidence on benefits of yoga, and then your recent research on benefits of yoga for cancer patients, I think it's just very, very important to show that dimension today, especially today on World Cancer Day. So what a way to celebrate that day and to share information that can be so beneficial, especially to those who are going through very challenging days. So would you like to tell us a little bit more about yourself and how you got to research on yoga, and how your research on benefits of yoga for cancer started, and how it's going on?
So by profession, I'm a physiologist, and I've gained my PhD in yoga physiology under Centurion College called St. John's in Bangalore. And I have been working on this yoga since at least 5 years now. And I saw that this could be useful for cancer patients who are post-diagnosis, are into distress. And I was thinking, yoga has several limbs. The most important, seeing scientifically, when we look at pranayama, breathing practices, we see asanas and meditation. And we started with 1 or 2 patients with cancer, and we see that there was good response, and they could say that, in fact, they told me, Madam, because of this, I'm able to come for treatment very happily. I get my treatment done and go. And this kind of triggered our interest. And this, has taken us at least to 100 patients for now. I'm working with cancer yoga since 2 years. And we see the doctors are also accepting it. Because yoga is being more scientific now. And I basically involve myself in building that scientific evidence and not just accepting as yoga as spiritual or, as a yama, niyama, and dharma. But I also look at how yoga as exercise can help.
Yeah, and I think that's really important, because then we know where in our body yoga is working, and then we know why is it that we're doing that. Because very often people look at yoga and, like, stereotypically thinking, oh, they're just sitting down and humming all day, or not moving. But actually there is a reason for doing all of that. So if I could just ask you my first question. So why would people choose yoga as an intervention in support of the treatment for cancer?
So for several years, doctors thought that no exercise and only drugs would help the cancer patients. But now recent research since probably 5 decades, we see that, and there are sufficient evidence to say that exercise is one of the factor can reduce the risk of cancer, as well as help in the improvement of the outcome of the treatment. So although the doctors do write in the prescription, at every discharge summary, they write 30 minutes of exercise. Patients are perplexed. What exercise do I do? Also for the reason, they are vulnerable to infections. They seldom venture out for a walk in a park, or they do not go into a gym. So what would be the best intervention then to keep them active? We see it's just yoga. You can do just with a mat. However, there can be contraindications if there is bone metastasis in cancer. So we need to be a little careful, and yoga needs to be taken as a therapy. And therapy is definitely different from the yoga that any other normal person would do. In this condition, yoga therapy is slower and more therapeutic. Of course, we do use breathing practices, pranayama, asanas, and meditation,
Yeah.
but the module is different here.
Yeah, and I remember when we chatted earlier, you said that especially dynamic yoga, that's something that we don't want because we do not want cancer patients to lose weight, but there are many movements that encourage muscle growth, encourage the maintaining level of tissue in our body that are not exasperating for us, and we can still do that as well as breathing practice.
So we see that in yoga, we can maintain our oxygen levels in our
Mm-hmm.
body, improve
Yeah.
circulation, which is very important for cancer patients,
Mm-hmm.
as well improve the muscle strength
Mm-hmm.
by doing yoga. Yoga is also a low to moderate intensity exercise.
Mm-hmm.
So this is a good mode of exercise, an optimum mode of exercise, which can help cancer patients to improve their circulation, oxygenation, and also maintain
Mm-hmm.
their muscle strength. Here, why we are looking at muscle strength is lesser the muscle during the cancer treatment, toxicity is higher.
Mm-hmm.
So we want to keep these muscles recruited, at least minimally, so
Mm-hmm.
that their muscles do not or we prevent the muscle loss or we cause sarcopenia. So yoga will definitely help during the treatment as well as post treatment as survivors.
Mm-hmm. Yeah, but I also remember you mentioned why breathing, pranayama, is so important for cancer patients, and that also links with the level of toxicity in our body. Would you like to expand a little bit more on that?
Yeah, with respect to oxygen, uh, in cancer tumors there is an expression called hypoxia inducible factor,
Mm-hmm.
which is expressed when there is low oxygen.
Mm-hmm.
So there are studies also saying that when the oxygen saturation, hemoglobin oxygen saturation levels are 98 percentage, the
Mm-hmm.
radiotherapy outcome is much better than when it is 97 percentage. Can you see that 1 percentage is making a difference?
Mm, yeah.
So the easiest way is to change the way we are breathing. And in cancer patients post diagnosis, they're already distressed, and anxiety sets in, depression sets in, their muscles are involuntarily contracting. So to ease them out, we can give them breathing practices, teach them the right techniques. So what technique
Mm-hmm.
can we teach? So
Yeah,
we
exactly.
know the respiratory system has 3000 to 4000 ml of capacity. We breathe only 500 ml. So taking
Mm-hmm.
few couple of minutes to breathe deeply, and we see physiologically 16 deep breaths can completely recycle your alveolar ventilation. That means all the oxygen, all the carbon dioxide can be completely recycled in our lungs. So this may improve, this may sufficiently provide oxygen levels in our body. And that is one work we are proceeding right now, progressing with. Hope to see good results.
Yeah, but it's two things, isn't it? It's oxygenation of your blood, so giving energy to your body, but also releasing carbon dioxide. I remember when you first time mentioned that when we were talking a few days ago about the importance of long exhalation. Because
Yes.
very often we told that your inhale should be shorter than your exhale, but then we don't really know why. And I remember how beautifully you explained that it's that first part of our exhale that is oxygen, but actually it's the second part that follows that is carbon dioxide. So what's the ratio between inhale and exhale? How long should that be? Do you have any recommendations?
Usually the breath rate is 12, approximately 12 breaths per minute normally. We
Mm-hmm.
can come
Mm-hmm.
down to 6 breaths per minute. However, in the 6 breaths, we can have the shorter, say what I do with the patients is 4 counts of breathe in, 5 counts of breathe out. Then we say 4 counts, 6 counts, 4 counts and 7 counts. So the patient understands that I need to go slower in exhalation. Slower, deeper exhalation will lead to expulsion of carbon dioxide. Also, with that expression, as I told you, the hypoxia inducible factor, preclinical studies have shown that whenever there is sufficient oxygen, it gets, suppressed. And this is one expression which is usually expressed in the tumors. So oxygen can suppress this expression and lead to, leading or preventing the progression of tumor. So these are one of our hypotheses, and we are working towards it. The preclinical studies have shown, but human body, we need to really work out and see.
Yeah, but just to make clear that I should very carefully and wisely say that's hypothesis, that's what we're working towards. So that's all research that is currently taking place. So we really want to be careful that people understand us. We're not saying do yoga and heal cancer. We're saying there are many things that you can do while you're undergoing treatment, so your quality of life is better. And maybe your survival chances are higher, and also it gives you that empowerment during that difficult time that you are doing something as well. That's correct, isn't it, Crystal?
Yes. So this hypothesis, although is still being looked upon and is not yet conclusive, what we can see very evidently is that post these kind of exercises and yoga therapy, we see patients coming to the hospital happily. That's very important.
Yeah.
No?
Yeah.
Less distressed, and they get their treatment done well. So that is what excites the doctors.
Yeah.
So the more distressed they are, they come up with several psychosomatic pain, and that kind of confuses doctors also. And while doctors do not have sufficient time to sit and talk to them and counsel and understand, yoga therapy helps them to be mindful, as well understand what kind of pain they are going through, whether it is just coming from here, and get their treatment done well.
So you've mentioned just a few minutes ago about anxiety levels and depression, and especially those states that potentially kick in when we suffer from cancer. So how can yoga help us manage those states of mind, and how is that related with our nervous system?
So what happens is when you're distressed, you have basically we have an automatic system which keeps our heart, lungs, our gastrointestinal system working. So it always activates when you are in a fight and flight state. As well, when you are diagnosed, a person is diagnosed, he's already in a fight and flight state, thinking, what's happened to me? What's going on with me? So this is going to release certain neurotransmitters at the sympathetic system. And this has another cycle, another pathway to follow, which is going to modify or modulate the immune system. So what happens when the automatic or the autonomic system takes up or becomes more dominant towards parasympathetic? There are cortisol levels decreasing, your stress level decreases, your anxiety levels also decreases. So even if they have not tipped into depression, they are in the verge of it, these therapies can help just by deep breathing techniques. But the techniques needs to be right and needs to be under the therapist, need to be taken under the therapist.
Yeah. Well, there's loads to take on, and just very, very important information that you're sharing. Is there anything that you'd like to say to people who are watching us in terms of, like, you know, a final message, or like, you know, something around yoga as the means for prevention of recurrence of cancers, or something to give a little bit of hope?
Here, definitely exercise plays a big role in the cancer treatment as well as cancer survivors. So we choose yoga because it is low to moderate intensity. And these kind of exercise, there is a little apprehension that will it cause metastasis. Metastasis is spread of the cancer. So physiologically, exercise, or here I would emphasize on yoga, will not lead to metastasis. One, for the reason the circulation is improved. When there is sufficient circulation, there is surveillance improving. What is surveillance I'm speaking about? Surveillance is the defensive mechanism that is, active in the system, which probably, identifies this abnormal cells and will be fought against. So yoga not only works on the body circulation physiologically, it is also working at the psychological level. So most important, what I saw is the patients become more mindful. They actually, yoga actually stimulates their the the mindfulness to understand what is going on in their body and take right steps accordingly. So when they're distressed, they do not know what to do. And although several help comes in for their situation, their financial situations, they need to take their own decisions. So people become more internally, they understand internally, becoming mindful and taking their steps towards cancer treatment. So it becomes easy even for the doctor to treat these patients. Most importantly, doctors are treating the disease. But what is lost in the bargain is the quality of life. Because cancer treatment is a long period treatment. It doesn't happen like where we take antibiotics for 5 days and we are okay. So what happens in cancer patients is when it is for 6 months long, or it may even prolong for a year, they go into distress. This kind of therapy, yoga therapy, introduced when they are diagnosed with cancer, will help them to sail through these high tides very easily. So we do not say that yoga can cure cancer.
No.
We definitely say it will support the treatment and help in prevention of cancer.
Yeah, so it's that holistic approach, isn't it? Because with traditional means available in Western medicine, we have ability to treat body or treat tissue with the chemicals, with the radiotherapy, with the chemotherapy, but actually it's that dimension of mind and what is happening on our emotional level that doctors cannot really treat that, can they? And that's where we have that additional benefits of yoga. And from what you were saying, we see that yoga can help as a preventative measure. It can work for patients who are already cancer patients, but then it also can help during the treatment. Because of all the different chemical changes that it initiates inside our body. I remember also you mentioned about cytokine IL6 and how it can behave
IL-6.
in our body. Yeah? Do you want to mention about that as well?
Yes. IL-6 is a cytokine. What is cytokine? Cyto is a cell, kine is a secretion. There are around 13 cytokines that are secreted in our body. And this is again a defensive mechanism. See, whenever there is injury, how does the body know? It secretes certain chemicals, and these are cytokines. So these
Mm-hmm.
cytokines help in specifically stimulating the WBC cells, which are the defensive cells. So IL-6 is one of the inflammatory marker, which is highly being studied. And we see that in cancer patients, mostly in metastasis, there is a lot of secretion of IL-6 saying that there is an underlying inflammation. So when there is inflammation, it always follows with increase in temperature in that area, as well as pain, because the temperature and the inflammation there, the chemicals secreted there stimulate the nerves, and that causes pain. Yoga in survivors, they have seen the IL-6 levels reduce. Now we are looking at whether doing yoga during the treatment also can reduce the IL-6 or the inflammatory marker. So if the inflammatory marker is at check, then the fatigue levels in cancer patients, which is one of the factor for fatigue, can also be reduced. So we are also looking at the anemia levels, because chemotherapy also follows with anemia. That is decreased count of RBC, WBC, RBC, as well as the hemoglobin. We have seen in some group, this is the smallest study we did, small pilot we did, and we see that the a subtype of the breast cancer, we see that the hemoglobin levels do not decrease even as just with the pranayama exercises. So this is something that I noticed in a subtype of breast cancer. So probably we need to take it forward with a larger group. So inflammation may be reduced when it modulates with pranayama, because pranayama modulates the autonomic nervous system. So inflammation can be reduced, one, through autonomic nervous system. That is one pathway. The second pathway is through asanas. So asanas, when you do the asanas, there is isotonic as well as isometric. When flexors are isotonic, the other set extensors become isometric. So when the muscles contract, again, these are cells, they also can secrete this IL-6. They are called as myokines. And these myokines can be anti-inflammatory. So IL-6 is a double-faceted. If it is secreted from an injured area, it becomes pro-inflammatory, giving you pain. But when we do exercise, this same cytokine, a secretion from these cells, when secreted from the skeletal muscles, can act as anti-inflammatory. So our body is definitely miraculous and wondrous. So we can see that the yoga can do it. That is one of our studies that we have taken. And we are hoping a lot of patients may benefit, and hopefully the pathways are also, we may conclude that yoga therapy through asanas, pranayama and breathing can help cancer patients to ameliorate the fatigue, which is actually, there is no treatment for fatigue. It needs to be just, you need to keep yourself active and do the right kind of activity to reduce your fatigue.
Yeah, but as you said earlier, in terms of inflammation, during cancer, it's the whole body is inflamed because of the cancer that is inside of our body, and then through the breathing practice or asana practice, we can like almost artificially get our body into a mode of contraction or expansion, which then is associated with production or production of positive cytokines, which then reduce inflammation. So we can see that cycle that, okay, I am in state of inflammation. What can I do to activate my very wise body into a state that on its own, it starts fighting the inflammation in the body, and that's through breathing, through physical practice, and obviously in addition to chemotherapy, to radiotherapy, and all the traditional means. So that's what I was saying earlier, that it's very much to show people that there are means that we can do ourselves and feel like we are empowered. It's not a helpless situation. It's a situation where we can also give and become active. And then, as you say, patients that you see coming for the treatment, they're happier, they're more relaxed, because it's also acting on the level of mind, not just the body.
Yeah. So yoga will help you to tap your instinct. See, we go by general notions. So in this situations like cancer, our instinct needs to start working, because you would see that the food we eat, we will not be able to eat during chemotherapy. There is difficulty in eating, there's difficulty in thought process, there's difficulty in cognition because of the treatment. And these symptoms can differ from person to person. So keeping yourself active and under the guidance of therapists will definitely help to maintain your quality of life during the cancer treatment. And I would again emphasize, yoga cannot cure cancer once established. It can only support. So keeping yourself active during the treatment is very, very important, along with good nutrition.
Yeah. Yeah. Well, amen to that. Thank you so much, Crystal, for sharing your wisdom, your knowledge, your experience, and also for talking in such an approachable and easy to understand way, because very often doctors, clinicians, or practitioners, they say things in a very complex way, which is frequently difficult to understand. So thank you so much for sharing that as well. And I can see it's already getting dark in India.
Yeah,
So
right. It's 7
yeah,
o'clock now here. It's 7
it
here.
is. Yeah, yeah. It's still, well, lunchtime here in the UK. So there's still a whole day ahead of us. So thank you so much for joining us today. We'll make all that recording available on YogoJo Foundation Instagram channel. So those of you who were not able to join earlier or just joined in, you will be able to benefit from what Crystal shared with us. And I'm sure we'll see more of you as well, because with everything that you know, there's many people who can benefit from that. So thank you so much for that.
Thank you so much, Joanna, for giving me an opportunity to give my views on yoga and cancer treatment here. We are basically trying to develop natural ways of, supporting the modern medicine. So we will be happy to collaborate with people, with you, who are through yoga as well as natural therapies, so that we can always support the modern medicine. We need to see what is the shortcoming, and we need to add in the knowledge from the other disciplines of medicine to improve the quality of life of cancer patients.
Yeah, yeah, exactly. Well, thank you so much. Have a lovely evening, really nice weekend, and I'll speak to you soon.